Now back to Senior Matters on the Big WECK. Welcome back to Senior Matters on the Big WECK. I'm your host, Joe Chille. With us today from the VA of Western New York, we have Rachel Castricone, who is a speech-language pathologist. I managed to say that without, blurring it. And Jennifer Simmance, who is a Dementia Care Coordinator. Welcome. Thank you for coming in this morning.
Thank you.
Thanks for having us.
Sure. Tell us about, I've given you your titles, but tell us about each of your roles at the VA.
Sure. Well, I am a speech-language pathologist, and so that provides me the opportunity to work directly with veterans one-on-one. So we work with them throughout the spectrum of care, and we initially will complete a screening if they have any types of memory concerns. And with that screening, those results will be provided back to their primary care provider. And if they need further testing, perhaps we'll do another evaluation. And when we do that evaluation, we're not only looking at the areas of difficulty the veteran may be having, but looking at their strengths and what can we do to facilitate their ability to perform activities in their everyday life. So we take a look at their goals during treatment in terms of what they want to work on collaboratively with their family and their caregivers, and then develop a treatment plan based on that. In addition to my role as a speech-language pathologist, I'm the co-chairperson of our local dementia steering committee. And so our goal is to promote dementia awareness. There are about 285,000 veterans currently that are diagnosed with dementia. So there's a big push right now for us to promote early identification and get those intervention and supports in as early as possible.
Now, when you talk about, and I know we're going to get to you, Jennifer, as well, when you talk about dementia, it's something that I would think affects everyone to a certain degree, or many people, not everyone, but to a certain degree as they get older. So how does it identify with veterans? Is this simply an age-related issue, or is it a combat-related issue, or is it all of the above?
So there's certainly risk factors within the veteran population. So there's veterans who have traumatic brain injuries, and that puts them at a significantly increased risk for dementia. Recent data from about 2018 indicated about 185,000 veterans who were using VA healthcare reported at least one traumatic brain injury. And in addition to that, within the same time frame, about 414,000 active duty service members had a traumatic brain injury reported. So we're going to obviously see some memory concerns with that brain injury immediately post, but there was actually a research study done in collaboration with the Alzheimer's Association, the Department of Defense, and the VA, which correlated traumatic brain injuries and an increased risk for developing dementia within this cohort. So since then, they've been working collaboratively to identify those patients who are at greater risk.
All right. And Jennifer, how, as Dementia Care Coordinator, where do you get into this whole equation here?
My role at the VA is to, once identified of some kind of a memory impairment, I am there to assist the veteran and the caregivers in their educational or resource needs throughout the transition of the disease process, and to basically help the veterans age in place for as long as possible and as long as they can stay safely home.
Now, what are the symptoms? And I know this is probably difficult because it may be different for a variety of different people, but what kind of symptoms should veterans be looking out for, or should individuals that maybe if it's a wife or it's a friend of a veteran or whatever, should be looking out for?
So forgetting's normal. I think that's a good place to start, right? All of us walk into a room and we forget why we're in the room.
Yeah.
Right. Yeah. So that's the environment's changed. So that's normal. So what we tend to say is if this is something that's occurring every day and other people are starting to notice, then it's a concern. So take the example of driving to the store, and you get to the store and you forget something. You get home and you forget something that was on your list. That's normal. But when we get more concerned is someone's driving to the store, they get out of their car, they don't even remember why they're at the store.
Oh.
Or perhaps look at the car and they don't even recognize that that's their own car. And we talked about social isolation. Those are factors or considerations that family and veterans should be looking out for.
So COVID, when you start talking about social isolation, during that period of time, there were kids obviously that were having the social interaction at school. There were adults. I had a postman, a letter carrier, come up to my house, and I said, "Hi, how you doing today?" during COVID, and he said, "Well," he says, "this route usually takes me like 4 or 5 hours to do. It takes me 8 or 9 hours because nobody has anyone to talk to, and they stop him and talk to him." I mean, it sounds weird, but I can get it. I totally understand something like that. So, what should a veteran do in the event that they suspect a problem, and conversely, what about someone that has to tell a veteran, "I think you're having a memory problem," and they say, "Oh no, there's no problem with my memory." And it might, I can hear people say that, not just veterans, but they'll say the fact, "Oh no, you're mistaken. No, but you told me this story twice yesterday and once today," or whatever. You know what I'm saying?
So first and foremost, you want to start that conversation with your primary care provider.
Okay.
They can rule out any reversible causes that may be contributing to the memory issues. And for your point, if the veteran or family member is denying that these things are occurring, the caregiver could certainly contact me, and we could discuss strategies to approach that person in a constructive way and hopefully try to guide them towards care.
Are there certain things that the mind or your memory that it doesn't want you to remember? I don't know. Maybe it's a traumatic thing, like getting married. No, just kidding. No, it was just a joke. But I mean, are there things like that? And is that something that may not be symptomatic, but something that just occurs regularly?
Well, truthfully, many veterans do have post-traumatic stress disorder, right? So many of them are trying to prevent those memories from coming into everyday life. So there's actually been some research out there for Vietnam combat veterans, which has showed about an 8% reduction in the part of your brain called the hippocampus, which works on learning, memory, and stress regulation. So with that, we're seeing physical changes to the brain. And the way I like to explain that is it's really hard for your brain to siphon out what it wants to remember versus what it doesn't want to remember. So that's a challenge, and that's something that we frequently target in therapy. And sometimes it's a collaborative approach, and they do need to have that behavioral health or that mental health support in addition to therapy for their memory.
I think that my hippocampus is always on spring break, but I'm not really sure. Senior Matters on the Big WECK is brought to you by Independent Health. The red shirts are all about your health. And PB Elder Law, Buffalo's trusted elder law firm. And this morning, we're talking to the VA of Western New York, and we're speaking with Rachel Castricone, who is a speech-language pathologist, and with the Dementia Care Coordinator, Jennifer Simmance. And what about the services available at the VA for a veteran with memory issues?
So some of the new things, something new that we started is every patient who's over the age of 65, when they go to their primary care appointment now, the team asks them whether or not they're having memory issues. And if so, there's a built-in order so the doctor can quickly recommend screening or other types of tests to ensure that the veteran gets an adequate workup. And once the patient turns 75, this reminder or this process occurs every 6 months. So we're really trying to improve early identification. In addition, in 2007, all of Veterans Affairs initiated a TBI screening. So this is for any veteran who served after September 11th of 2001. Every time they go to their primary provider, they have a screening for traumatic brain injury.
Yes, meaning TBI. Is it something, and I don't mean to make light of this, but oftentimes, I think as you get older, because I'm going to be 70, I'll see somebody and I won't remember their name, right? And I'll say, "Oh, what's this person's name?" The more I think about it, the more I can't remember it. I'll walk away to my car and I'll remember their name. Is that a common ailment? Is that it scares the living daylights out of me because, and I always would say, if there's somebody with me and somebody comes up and introduces themselves, I said, if I don't introduce you, you give your name to, you know what I'm saying? Is that a weird thing?
No, that's very common actually, and it's exactly what you said, the reason why, because you're hyper focusing on all the things that you think it should be, and that's what prevents you from thinking of the actual name. And as soon as you walk away, the environment, all of those thoughts have kind of subsided, and then you're able to remember the name. So
it's almost like being nervous about something, right?
Yes.
And being focused on that one thing. Great, because I can't remember my ex-wife's name for the life of me. So it's okay to laugh. I'll get the letters. You guys will be fine. You guys will be fine. I'm just teasing. So what's your recommendation? We have about a minute and a half left. In the event that people are listening this morning, they want to know more, they have questions, what should they do?
If there are questions and about their concerns for their memory, contact their primary care office and make an appointment to meet with their provider. If they need general information, they can contact me at the Western New York VA, the Dementia Care Coordinator, and we can make an appointment to either talk on the phone or meet face-to-face, discuss concerns, and I can provide many more resources that we have through the VA.
And they shouldn't be embarrassed, right? Because I'm sure embarrassment is a big thing with regard to this. Even going into the doctors, you go in and they say, if you have any memory problems, any issues with balance or things, and they ask you some of these questions like the same time. And it's almost think, do you get specific funds in the event I answer yes to this or whatever? 716-862-8829 or www.buffalo.va.gov. Thank you very much, Rachel and Jennifer, for joining us this morning on Senior Matters.
Thank you.
Thank you.
You've been listening to Senior Matters on the Big WECK, the only one-hour radio show devoted to the adult population of Buffalo and Western New York.